And I understand we're here to talk a little bit about your eyes.
Yeah.
Right? Yeah. So tell me kind of what you're seeing, how that transition has kind of been over time. Is this something that you've always kind of noticed? And then what you'd maybe like to see?
Yeah, so I've had problems with eye bags since I was a kid. Everybody's always like, how much sleep did you get? I'm like, 8 hours, just kind of the way my face is.
Feel fine.
Feel great, Thanks for letting me know though. Tried everything, tried the eye creams, tried hydration, tried resting, tried the extra pillow, all the things that other people
you do the preparation H, that's the trick.
Everything,
trick.
Everything, and everybody's like, oh, I just did this and it went away. I'm like, yeah, that worked for you. Didn't necessarily work for me. So kind of looking at this as a possible solution and just looking to, I am single, but also, trying to get into acting modeling. So that certainly wouldn't hurt either.
Yeah, absolutely. Absolutely. It's amazing how much shadows on our face, especially in our central face, can kind of deceive our energy level.
Yeah.
More than anything else. So it says a lot about you without you even really having to say much, which may not be saying things that you want to be saying.
Exactly.
Yeah. So it makes a lot of sense. All right, well, I'll give you a mirror and we'll kind of look together and come up with a plan for you.
Sounds great.
Okay. Any questions kind of at the outset?
Everybody is like an armchair doctor these days, or I am, cause I look at stuff online and I was just wondering if, would I be like a pretty straightforward case, or like, what are your thoughts on, I mean, clearly they have some genetic, little fat pockets right here, but just wanted to get your thoughts overall.
Yeah, okay. Happy to go through that. And that's I like that you brought that up, because there's a huge component of this that is kind of genetic and things that you're kind of born with. I would guess someone in your family probably has similar eyes, right? These tend to be, shapes that tend to run in families, and it's either mom or dad's got similar eyes for the most part. But let's kind of first talk about what we're seeing.
Okay.
And then I can kind of help you understand exactly why we're seeing it.
Okay. Sure.
So kind of point with me to the area that you're kind of focusing on.
It's the biggest problem's right here, I would say. Like, it kind of bowls out right there. And I've been told it's fat pockets, and I have, I'm not like the best shape in the world, but I have a relatively low BMI. It's not like I'm super obese or anything. So I think, to your point, it is a little bit genetic.
Yeah. So you're kind of spot on. So what we're seeing there is actually a couple things going on. So the eye sockets, the thing that's kind of protecting and holding our eyeball, is filled with fat, and that's good, healthy, protective fat. It has nothing to do with how fat you are in your body or anywhere. It's protective fat that's there to hold it and protect the eyeball, and kind of cushions it. And depending on how much fat you have there, or the size of the eye socket, that will determine how that fat sits within the socket.
Okay.
Does that make sense?
Yeah.
The other thing that's going on is that there are structures here. It's like a retaining wall, and that retaining wall is kind of holding that fat into the socket.
Okay.
As we get older, more mature, that retaining wall tends to thin out a little bit. So it allows the fat to kind of pooch forward, which will worsen the back.
Right.
That's all that is. So that's what's causing this fullness here, right? But the other issue, and the more kind of obvious or prevalent issue, is the shadow below it. If you were just puffy here, there wouldn't really be much that people would see. It's that second shadow line right here. That's what really speaks to everybody. So what that is, it's a combination of this hill developing here, right next to a valley below. So the valley is a little bit of some lack of volume.
Sure.
So you haven't been blessed with super full cheeks.
I know. Yeah.
Right. A little bit on the flatter side, which is just how you're put together. Your bone here, the cheek bone, is set in a little bit, right? We call that kind of mid-face atrophy or deficiency there. And the other factor is that as we get older, the fat that is here falls down with gravity. So things come down, and then you have a combination now of this hill right next to a valley. So to fix that shadow, we have to do two things. We have to reduce the hill, and we have to fill the valley. Okay. So for patients who just have like a little hill, like a mound,
right,
if you will, they have a little bit of shadowing, but not so much of a bag. Then they're a really good candidate for under eye filler, or some type of volume, with a fat grafting or something, where all you're doing then is just kind of filling the valley, and that can take the shadow away. But for you, since your hill is a little bit more advanced,
Yeah.
we would have to fill the valley to meet the hill to like a comical degree. You'd look like a baboon, right?
Sure.
So it's just not a reasonable or practical option for you to have you still look natural.
Sure.
So we need to do two things. We have to reduce that hill, and now we can bring up the valley tastefully and elegantly and in a masculine way
Sure.
to help create a nice contour there.
Okay.
You follow? Yeah. So how do we do that? We have a couple options.
Okay.
A traditional lower eyelid blepharoplasty, which is what this is called. A traditional one involves making a little incision right here under the lashes. Mm-hmm. And then through that incision, we can reduce the amount of the fullness, we can reduce the fat. Mm-hmm. We can maybe tuck some of this fat down to fill the valley. Right? We can do some fat grafting from somewhere else on your body. We can borrow fat and use that like a natural filler to fill the valley. And also, the big advantage to this is that we can cut away a little bit of extra skin.
Okay.
Right? So that can kind of be a nice combination to give you a smoother contour there. The problem, and the reason I don't love incisions right here under the lashes, generally speaking, is because as all scars contract, or as they heal, they contract. So there's potential now that as this incision here under the lashes is healing and it's doing its normal thing, if this contracts, you can see, look together in the mirror. So there's potential that the eyelid can get pulled down like that, which can be pretty deforming. And that's very difficult to fix. So in most people who don't have significant extra eyelid skin, which I would say you do not have significant extra eyelid skin, you don't need that incision, okay? So the alternative is the procedure I favor to come in from behind the eyelid. Okay. So by coming in behind, we can still remove the extra fat. We can still do fat grafting or tuck the fat down and fill the valley, but we now avoid the risk of the eyelid getting pulled down as much.
Sure.
So it's a nice compromise. Now, because I can't make that incision there, or not in that case, we have to do something to address the skin. So if the patient, like yourself, is a candidate, then I usually like a laser. So that's where we'll take a CO2 laser and we'll just zap this area with a laser and get about a 10 or 20% improvement in skin tightening,
Okay.
but not so much risk of the eyelid getting.
So no retraction.
Yeah.
Okay.
Does that make sense?
Yeah.
So that's the procedure. So we can come in from behind, we'll reduce the hill. For you, I would prefer fat grafting as a way to help fill this area because you have room to add a good amount of volume. Mm-hmm. And it's not just volume here that I think you'd like, but you could, help to add a little bit around this way. Mm-hmm. Again, for guys, really critical, we don't want to feminize your face.
Right.
And if we overdo this, especially in the cheeks or around the eyes, it's very quickly till you look weird.
Okay. So subtlety is key.
Less is more, especially for you. Yeah. But I think you have room to kind of add a good amount of volume in the cheeks, reduce this, and you can see the combination. If we bring the hill down and we fill the valley, I mean, that's your new contour right there.
Yeah.
So it's a combined approach. And the nice thing is by doing a couple different things, each one conservative, they work together really nicely. So your end result looks more natural.
Yeah.
As opposed to trying to get a really great result by doing one aggressive procedure. You do several of them more conservatively and they play nicely together.
Okay. Cool.
So the procedure can be done under what's called twilight anesthesia.
Okay.
So it's not general. You are still breathing on your own.
Okay.
At the same time, you're not feeling anything.
Sure.
You are asleep. It'll still feel like a minute went by and you're in recovery. But this way, there's no breathing tube. It's all done through an IV, similar to a colonoscopy.
Okay.
So you're probably too young to have had one already.
Thank God, yeah.
That's the type of anesthesia. It's called sedation.
Okay.
The procedure here takes about an hour,
Okay.
give or take. If all we're doing is the lower eyelids, about an hour. There's a little bit of time to borrow fat, and that's done through micro liposuction. Usually we'll go through the belly button. Sometimes we'll go around the thighs. We're not making massive contour change.
Sure.
People always want me to go more. It's tiny.
Yeah.
We just need a little bit of drops of fat.
Okay.
And then we remove the extra fat from under the lids, and then the last part's to do the fat grafting and the laser.
Okay.
Generally, you're with us for about 30 minutes.
Okay.
Some time to just kind of wake up. You'll need somebody to drive you home and be with you overnight, just for anesthesia perspective.
Sure.
Okay. And then you're healing. So most people tell me it is more uncomfortable as opposed to truly painful. That's most of the procedures we're doing. They're just more uncomfortable. I like you to avoid any like reading or scanning with the eyes for a couple days.
Okay.
So I wouldn't plan any aggressive work emails or anything, within the first couple days.
Okay.
You can watch television and relax, but I want it to be far away so your eyes aren't really moving a lot.
Makes
left
sense.
Right.
Okay.
We'll give you all the medications you'll need, pain meds as needed. There's really no care here because there's no incisions. Yeah. It's all on the inside. I don't even put stitches on the inside. It heals beautifully. Okay. The fat grafting is done through a little needle poke hole, and that heals up to nothing. So the laser area is really the only thing that would be something you'd see on the skin. That's just, it looks like a little sunburn for a few days.
I've seen those before.
Yeah, kind of settles down. Most people, we say, are restaurant ready by about 2 weeks.
Okay.
Okay, so if you kind of have an idea, maybe some bruising, you'll be pretty swollen, kind of fullness under here. You might actually like the swelling.
Okay.
Because you have room to add
volume.
A good amount of fullness there.
Yeah.
So you might actually like the swelling. Okay. But generally speaking, 10 to 14 days, I would say, for recovery.
Okay.
Light exercise, after about 2 weeks.
Okay.
Kind of build it up from there. The main risks for this procedure are bleeding. So when you talk about surgery around the eye, the one thing we're kind of watching out for is bleeding. So I have you take it easy, just for kind of 48 hours, kind of couch potato. I still want you getting up, taking deep breaths, walking to the bathroom. I don't want any other issues with blood clots or anything.
Sure.
But that's the typical kind of recovery.
Okay.
Questions about any of that?
Yeah. So, the main concern I'm trying to solve here is the ibex, right? But obviously, cheekbones are a good thing too. Like, I'm going for something conservative, something natural, but will there be a positive impact on the cheek area as well, or will that be kind of secondary?
So for me personally, whatever I would be recommending, I always want it to be as natural as possible. Yeah. So I wouldn't want to recommend cheekbones if you never had them,
right?
Necessarily.
Sure.
And I wouldn't want to try to create something that may not work with the rest of your face.
Sure.
But still, we want a balanced, for you, a masculine result. So I don't want to get too cheeky.
Sure.
But at the same time, you have room to add volume. So when we're adding volume, and that's the beautiful thing about the fat grafting, is that it's like a paintbrush. We can put color wherever we want to put color. And I want it to blend well. So usually we're putting some under the eye, also around the cheek to help it blend so that it looks like that's all you.
Yeah. Okay.
So I think that it's super powerful in that sense. The one thing I want to be clear about with fat grafting is that the procedure has some inherent limitations. There's a reason that there's all these different ways to do this. The thing with fat grafting is that it's a little bit inherently unpredictable. Okay. Because we're borrowing fat cells from one part of your body, right? We're rudely ripping them away from their blood supply, and now we are gently replacing them back in. They need to get a new blood supply. Otherwise, those cells will just get broken down and kind of go away.
Sure.
So some component of the fat that we put in may not take.
It's like a percentages thing. Yeah.
Exactly. So on average, it's about half,
okay,
give or take. But it's not like all of this side's going to take and none of this side. It's generally a nice, even distribution.
Okay.
People often ask me, well, do you put extra, thinking some of it might go away? And I say, no, I don't want to do that. Because if you're one of the people where all of it takes and we've put in extra, well, now you're hosed. Like, there's no great way to fix that.
Okay.
So I put in what looks great and natural on the table. And then knowing some of it might kind of get absorbed a little. But generally speaking, it's always going to be nicer than had we not done it, right? And if we need to, we could always do a touch-up, like a year or so later.
Yeah.
Or if it's a tiny dot, you just need a little volume right here, then that's easy to do with filler in the office. So both of those are options. 100%.
I think I would rather take a conservative approach and say, well, I didn't get 100% look I want, but it's still objectively better than say, oh, we went too far. I would much rather do that.
Completely agree. For you, absolutely less is more, but I still want things to look natural. I want them to be really, really great for what you want, right? But I think that's a good plan.
Sounds great.
Yeah. In terms of logistics, so I'll have you kind of meet with my coordinator and she'll go through all the numbers with you. Next steps would be finding a surgical date that works for you. Once we settle on a date, we'll do a preoperative appointment. That happens about 3 or 4 weeks before.
Okay.
Okay. That's when we go over any other questions. We'll take our photos. I'll send in your prescriptions. I want nothing on your brain going in on the surgery day.
Sure.
Okay. Super relaxed, ready to go.
Sounds good.
All right. Other questions?
I don't think so.
Okay. Nice meeting you, man.
Nice meeting you too.
Yeah. Just sit tight. She'll be with you shortly. And I'm available for anything else.
Sounds great. Have a good one.
All right, you too.